Hi friends, welcome to General Surgery Medicine. Now we'll be discussing on a very important and interesting topic called cytoreductive surgery and Hipec, that is hyperthermic intraperitoneal chemotherapy. It is a recently developed method for treating peritoneal malignancy. We'll be proceeding in this topic in the following manner, that is why Hipec or the need for Hipec, its indications, what is PCI, technique of Hipec, the drugs used in this technique and its associated complications. So why Hipec? As we all know, most cancer within abdomen or pelvis disseminate via three routes, that is through hematogenous route and through lymphatic, and third one is direct implantation or through peritoneal spread. As we all know, certain spaces in the abdomen are often most prone for malignant deposits such as subhepatic or retrohepatic space, hepatorenal recess, subphrenic space or pelvis. These are due to the most common reason that these are the dependent peritoneal surfaces, and malignant deposits occurs due to gravitational force. Certain other regions such as the omentum, the undersurface of diaphragm are also the most common sites of malignancy, and this is due to the reason that there is peritoneal fluid resorption which occurs here. Thus, these regions become the most common site for malignancy. The point is, to treat malignant deposits in these regions have always become a surgical difficulty. Hence, we have come up with this new technique called Crs and Hipec, which we will discuss in subsequent slides. What is PSM? It is nothing but malignancy arising from the peritoneal surface. It can be either primary arising from the peritoneal surface itself or a metastatic deposit from some other region. The primary is rare. It can be mesothelioma or primary peritoneal serous carcinoma. Metastatic is malignancy arising from intra-abdominal organs such as appendix, colon, rectum, stomach. The major problem with this type of malignancy is that the systemic IV chemotherapy had little peritoneal penetration, and hence the concept of Hipec was developed. CRS and Hipec is a multimodality procedure. The aim of the procedure is to remove all the peritoneal deposits. First, it was described by Dr. Paul Sugarbaker. Hence, this technique is known as the Sugarbaker technique. The procedure as such involves two steps. First is cytoreductive surgery. Second one is Hipec. In cytoreductive surgery, parietal peritonectomy is done along with removal of involved organs, followed by Hipec. In Hipec, the abdomen cavity is perfused with heated fluid, and the temperature here is important, that is 41 to 43 degrees Celsius. Heated fluid containing chemotherapeutic agent. And the duration of circulation is also important, that is approximately 90 minutes, can vary from 60 to 120 minutes. The combined technique is called the sugar baker technique. Indications for HIPEC are non-invasive peritoneal carcinomatosis, pseudomyxoma peritonei, peritoneal mesothelioma, peritoneal seeding from invasive malignancy, perforated GI cancers, tumors with positive margin or tumor spill occurring during surgery, malignant ascites, and GI cancer with positive peritoneal cytology. There are certain other indications also, but these are the most commonly followed indications. PCI is peritoneal cancer index, which is nothing but a grading tool to suggest the extent of peritoneal carcinomatosis. It basically consists of two variables, that is the distribution of the surface malignancy and the size of nodule in each of these regions. Actually, the abdomen cavity is divided into 13 regions and the size of the largest nodule in each region is taken into account and specific grades are given. So, the maximum possible score is 13 into 3, which is 39. Sugar Baker in his study determined that when PCI is less than 10, the 5-year survival rate is approximately 50%, and when PCI is 11 to 20, it reduced to 20%, that is the 5-year survival rate, and when PCI is greater than 20, it is almost 0%. Thus, PCI can also be used to know the survival rate of the patient. You can wonder why heat, that is why hyperthermic. Heat itself has certain advantages, that is it increases the drug penetration into tissues, so better efficacy, and also it increases the cytotoxicity of chemotherapeutic drugs that we give. Heat itself has anti-tumor effects. Thus, all three of these benefit the patient by giving hyperthermic chemotherapy. Certain other benefits are the renal toxicity of chemotherapeutic drugs given IV are avoided, and nausea and vomiting is avoided. Also, during the intra-op chemotherapy, there is manual distribution of drug and heat uniformly to all surfaces of abdomen and pelvis, which is a major advantage of. Coming to technique of HIPEC, it is practiced as open and closed technique. In open technique, the abdomen wall is elevated by using sugar baker retractor so as to create a funnel to accommodate the chemotherapeutic drug. As you can see here, this is a patient and there are two catheters inserted into the patient. This is called an inflow catheter and this is an outflow catheter. As you can see, the chemotherapeutic drug is injected into the catheter. It passes through a pump to a reservoir, which is a perfusate, which then passes into a heater, which heats the liquid to 44 to 46 degree Celsius externally so as to reach a temperature 41 to 43 degrees Celsius core temperature. The procedure as such lasts for 90 minutes or approximately 60 to 120 minutes. Temperature probes are placed over the skin to regularly monitor the temperature. Two important benefits of HIPEC are the route and the timing. Giving chemotherapeutic drug intraoperatively has high response rate. Also, the exposure to peritoneal surface is increased. Timing is you are giving the drug in the immediate intraop. So, the chemotherapeutic drug diffuses better into the peritoneal layers before the post-op adhesion occurs. Coming to various chemotherapeutic drugs used in Hipec, the most commonly used one is mitomycin C, which is used most commonly in peritoneal carcinomatosis of colorectal or appendiceal malignancies, and the suggested dose is 12.5 mg per meter square to 35 mg per meter square and infused over 90 minutes. Recently, oxaliplatin and irinotecan have also been tried. Cisplatin, which is used for mesothelioma, ovarian or gastric malignancy, is found to have higher incidence of nephrotoxicity, so it is avoided in most of the cases. Coming to complications of HIPEC, it can be broadly divided into surgical related complications, chemotherapy drug induced complications, the catheter which is used to infuse the drug related complications, and certain other complications. The surgical one are the major, which is anastomotic breakdown, prolonged ileus, chances of DVT, pulmonary embolism, cardiac and neurovascular complications. Chemotherapy related complications are most commonly myelosuppression. Catheter related complications are the leakage of drug from the catheter and its associated complication, chances of ascending infection. Certain other common complications are chemical peritonitis can occur. Abdomen distension, bar pain. Thus, we have completed CRS and HIPEC briefly. Hope you enjoyed the lecture. Thank you.